So welcome everybody to our October Mobility Learning Community. Great to see a nice sizable group. We are excited to talk about the Travel Helpers program today. But before we jump into that, we are going to provide a little bit of time for folks to introduce themselves. And so we are recording, and we would ask that folks stay muted when they're not speaking so that we get better audio. But what I'd love to do is just go around the Zoom room and have folks share your name, your community or organization, and how you're involved with transportation access. And so I am Zoe Miller, as I think I know most of you at this point. I'm here wearing my Moving Maine facilitator hat, and I am involved with a lot of different pieces of transportation access. And one of the most exciting pieces for me right now is getting a bus pass program up and running for asylum seekers in the greater Portland area. So it's been a long time coming, and we actually are about to set a kickoff meeting to do that pass program. And that will be to some extent a pilot of what could be done for other populations who have no income or very limited income. So super excited about that. And I'm going to go to Joe Cooper, who's on the top left of my screen. And then I'll call on people so we can go so we don't get stuck feeling like it's gym class. And I would invite folks, if you're able to turn on your screen, please turn on your screen, because it's so nice to see people's faces, especially on a rainy day. But we understand that folks need to multitask, and so we're just glad to have you here. So Joe, if you want to introduce yourself.
Sure. Nothing like going first. I'm Joe Cooper. I am currently the project consultant for Maine Council on Aging's project on transportation equity for healthy aging. I am a former executive director of a volunteer program that helped older people in Hancock County, Friends in Action. And so Hancock County is where I live.
Thank you. And Cheryl Peabody, you're up next. Oh, but you're muted. There you go.
Sorry about that. I don't know what happened.
No worries.
I'm Cheryl Peabody. I have a couple of hats wearing. I'm the executive director of Maine Statewide Independent Living Council. But I also have limited vision. So I also serve on some organizations for blind and visually impaired people, which is kind of what I'm interested in increasing efficiency for transportation for those of us who can't drive.
Great. Thank you, Cheryl. And Marcia Bennett. And then I'll cue people up so you know you're coming. So Marcia Bennett and then Jessica Sear.
Good afternoon, everyone. I was the mobility manager at Western Maine Transportation. I still am, but I'm now the operations director. So I'm doing both roles, and we represent Franklin, Androscoggin, and Franklin, Oxford, and Androscoggin counties, and we provide service in Brunswick. So we're just trying to meet anyone's needs who gives us a call. It's a challenge for sure, but we're hoping that we can keep meeting the needs.
Thank you, Marcia. And Jess.
Hi, I'm Jessica Sear. I am a person with a disability. I have a spinal cord injury and I'm in a wheelchair. I am also here from the Maine Statewide Independent Living Council, along with Cheryl. And yeah, that's it.
Thanks, Jess. And I said I was going to give people a warning, and sorry, I sort of failed at that. But so Kat, you're up next, and then Ken.
I had a feeling, Zoe. Hi, everyone. I'm Kat and Violet. I work I'm with GPCOG, Greater Portland Council of Governments, and I am the community engagement coordinator here, and I work to include more people into the transportation planning processes and to improve transit access, especially for community members who experience transportation barriers. So I'll be presenting today about a program with my colleague Marcel.
Great, thank you, Kat. So then we have Ken, and then Sarah Cushman, you're up after Ken. Oh, Ken, you're muted.
Wow, that's interesting. Ken Capron from Portland. I represent a couple of organizations. One is the Southern Maine Research Institute, which is just being formed, and the other is Microrail, which is an alternate mode of transportation, which just had a great discussion this past week with GPCOG about, and I'm trying to promote the best opportunities for transportation across the state and the country.
Great, thank you, Ken. So Sarah, you're up, and then Terry Palmer.
Hi, everybody. Thanks so much for doing this. As always, I love this learning process. I'm a transportation planning consultant. I'm also the faith representative to the steering committee for Moving Maine. Yeah, I carry this sort of huge piece in my heart for transportation access and justice really issues as well. So thanks.
Thanks, Sarah. So Terry's up, and then Wendy Jorgensen.
Hello, everyone. I'm Terry Palmer. I'm the statewide mobility manager for the state of New Hampshire. And one of the reasons why I joined your meeting today is I'm always willing to learn what's going on in other states, because Maine is as rural as New Hampshire is. And I've actually been in a couple of meetings with Zoe, and actually I recognize a couple of you as well from some other meetings. So I'm always looking to see what my neighbors are doing, and hopefully I can bring it back to New Hampshire and implement it here as well.
Great. Well, we're happy to have you here, Terry, and we're watching what New Hampshire's doing and feeling some inspiration, and hopefully we can get something similar going here. So you may be coming back to tell us more about what you're doing. So we have Wendy and then Laura Graziano.
Hi, everyone. I'm Wendy Jorgensen. I'm the Director of Population Health here in Central Maine for both Maine General and also for our ACO, Kennebec Region Health Alliance. And in part of my work, I oversee a team of community health workers. And, certainly one of the challenges that we have for the patients that we're working with is transportation. And so always sort of looking for potential resources to help support our patients. And it's transportation is one of the things we've identified out of our, community health needs assessment as an area of focus. So happy to be part of the conversation. So thank you.
Thank you, Wendy. So we have Laura, and then after Laura, Michelle Griffin.
Hello, my name is Laura Graziano. I'm the Assistant County Planner with Lincoln County Regional Planning Commission. So I do a little bit of everything. I'm looking to sit in on these meetings to get a better understanding of where the state is at for transportation, especially in more rural areas. Thank you.
Great. Michelle, and then we'll have Ryan Neal.
Hi, everybody. I'm Michelle Griffin. I'm also a little bit of a stalker. So I am from North Central Kansas. And so I'm a regional mobility manager. I cover 8 counties. There are 5 other mobility managers in Kansas. We each have our own coverage area. So we are definitely watching what you guys are doing. We love what you guys are doing with your network. We've actually started our own small network in Kansas. So hopefully you guys don't mind that we're copying some of the things that you are doing. And so I'm just here to learn more about these programs and see what we can share and borrow and steal. So thanks for letting us join also.
Thank you, Michelle. I love it. And we also watch you too. So you're doing great stuff. So it's great to have kindred spirits. We'll go to Ryan and then Tim Sturdivant.
Hey everyone, good afternoon. I'm Ryan Neal. I'm a policy development specialist in the Bureau of Planning at the Maine Department of Transportation, working on several related initiatives. Probably the most relevant one is our statewide strategic transit plan, which we're hoping to have a draft available for public comment in the middle of November. So keep an eye out for that. Thanks.
Thank you, Ryan. So we have Tim up next and then Dean Williams.
Hi, everyone. I'm Tim Sturdivant with the Department of Health and Human Services, and I manage the Office of Family Independence Whole Family Service contracts. So nice to see you all.
Dean is up and then Craig.
Hi, yeah, Dean Williams from Southern Maine Planning and Development Commission. I'm the transportation planner here, so I work with a lot of towns in Southern Maine on a variety of different transportation matters.
Good morning, Craig Zerhurst with Western Maine Transportation Services. I have the great pleasure of working with Marcia Bennett. I am the Community Relations Director.
Great, thank you. And my boxes moved around on me for a second, but I think we have Hope and then Melindy and then Megan. And I think that'll bring and then Marcel.
Hi, everyone. I'm Hope. I work for Efficiency Maine and I help run the EV rebates program.
Hi, I'm Melindy Thompson. I work in the Population Health Department of the Maine Health Medical Group. I'm manager of social determinants of health and equity, working on a strategy to address social determinants of health, including transportation for our patients.
Hi, my name is Marcel. I'm with the GPCAG. I work in the Mobility for All program where we help underrepresented communities to access transportation, but also play a role in the transportation planning and decision making. I am a community engagement specialist. Thank you.
I'm Megan Howe. I'm with Maine Health, with the Population Health Department complex care management area. And transportation to medical appointments is a big challenge for many of our patients.
Great, thank you, everybody. I think we got everybody in. Anybody that I missed? Hopefully not. Okay. So before we jump into the presentation, I just wanted to share just a very brief overview of our goals for these sessions. So, we want to share expertise, and so as much as possible, share what's going on around the state and hear from our awesome friends all across Maine. So if you have an idea, if you have something you want to share, please let us know. We want to move to action on transportation solutions. So, it's really, the idea is that you get information, you get inspired, you find people to partner with, and you make things happen. And so I know it's funny, I already heard from somebody who couldn't attend today and wants the travel helpers training. So I'll be talking to Kat and Marcel about hooking them up. And then the third piece is building relationships, which are actually super connected. Building relationships is very connected to moving to action, and I talk about us building this relationship infrastructure so that when the opportunities arise, we already know the people to call and to ask to partner with us. So very excited to introduce Marcel and Kat, who already kind of introduced themselves, and I'm sure they'll share a little bit more, but I had the great pleasure of working with both of them at Greater Portland Council of Governments and being part of, oh, sorry, my cat wants to make some noise in the background. Got to be part of the initial thinking on creating the travel helpers training, and it's been really fun to watch them run with it and to have them here today to share with all of you. So You should be all set to share your screen, Kat and Marcel, and I will turn it over to you.
Thank you, Zoe. Good afternoon, everyone. While Kat is sharing the screen, as we said, my name is Marcel. I work with GPCAG. We co-manage the Mobility for All program, which Travel Helpers is one of those programs that we are going to talk about today. And we are very glad to present this program to share. This is a model that can be also replicated in the region. We are very glad to present it today because we know that Moving Maine is focusing on connecting different partners, stakeholders for mobility management, but also raising awareness of the transport mobility options that are available in the region. So this, like, we can say that Travel Helpers is a kind of one of the milestones or small project, pilot project that started at the very regional level to be able to promote mobility management, but also enable people access transportation resources or get informed about available resources and the mobility option in the region. So we are before we get started, then we are going to reach these two goals today, to share a kind of model of travel training program for staff of healthcare organization and human services, caseworkers and patient navigators, a kind of program that helps them to be able to provide the service to people who need to learn how to use public transportation, how to access resources, how to access information about transportation. But also, as I said, this is, we are going to share how we did it, but also kind of a model that can be replicated across the state of Maine. This is something that started here in the Southern Maine region, but can also be replicated. This is a model. We are going to share the context and background and the timeline for this project, Travel Helpers, and then show how we convened the planning group that was an advisory committee for this committee, and then how we created the curriculum, and then the handbook, which was a narrative document that goes hand in hand with the curriculum, and then how the recruitment went, and then the training results, and then moving forward with the program. So what is Travel Helpers program? This is a program, a module, trainer module that helps equip staff of human services and healthcare agencies to offer travel training and the trip planning to their clients and the patients. This also applies to volunteers who want to teach neighbors or community members how to use public transportation. But also, travel training provides community members with knowledge. It provides knowledge about public transportation in general and skills about how to use it, including paratransit, and then be able to navigate the system independently, but also safely. The background of the project, everything started the voice and the needs that were in the community. Different plans came to the same conclusion about the need of increasing awareness of mobility options, but also the need of improved coordination of transportation services. So the idea was first came first at the Transportation Community Network meeting, which is a platform and a meeting where transportation partners meet regularly to share information about public transportation. And then from there, they developed the structure of piloting and the piloting activities for regional mobility management, the program in Southern Maine, like travel helpers, which can be also replicated later across Maine and even other different regions. And then this program was funded by FTA, which we also were, the money were also used to fund the Moving Maine Network. These are kind of goals for the program. The program aims to equip caseworkers and patient navigators to better help people navigate the system, but also it helps caseworkers to promote the independence of travelers, people who use, or that people like the most vulnerable people, people with disabilities, immigrants and refugees. Those are kind of people, whoever needs help, the program helps those people to gain confidence. It also provides the more tools and the resources, information about public transportation, available resources. And then also it is a kind of a model for the train the trainer style training that can be also replicated around the region, a model that other region can follow. This was the timeline for the project. This is how we started. After scoping the project, we recruited the planning group that served as advisory committee. And then we developed the training curriculum and the handbook. We recruited the piloting organization because we had to have one organization or two to pilot, to continue to do the training, because this was a pilot project. We conducted the training and then evaluated the outcome of the training, the program, and then we hand off the project to piloting organization, which we'll talk about later. This is the planning group was the first step in the project. After the scoping, we recruited human service and healthcare organization partners in the region. We reached out to different partners who can refer organization or they thought could be a good fit to be on the planning group. At the kickoff meeting, when we had our first meeting with the members, the advisory committee that were already recruited, we also asked them who else could be on the committee, who could be represented on the group as well. So the planning group included representatives from these different organizations, but we were able to recruit these people because of the connection, leveraging the connection that we had. So this is a list of members who were serving on the planning group. The planning group had the specific roles to inform the development of the curriculum and the implementation of the training as a whole, but also they helped to make connections with the organizations, healthcare organizations, and the other agencies that could also continue to pilot the program. The group also helped with evaluating the program, because we used to do meetings and double check constantly with the planning group. After the recruitment, then it was a phase where we needed to know what to cover in the curriculum, because we were going to start developing the curriculum. We sent out surveys. Well, the first survey was for the public, general members of the public transit users. We asked questions like we needed to know what was difficult for them when they started using public transportation, and then what they thought was preventing many people from using public transit. We asked a lot of questions, but also we surveyed the planning group because those were people from key partners, organizations that work with people with transportation challenges. So they were the right people to ask the kind of information, the topic that could go in the curriculum. So we asked them questions like if they were to teach someone how to use public transportation, what they would focus on. So we were able to collect those kind of information. So the draft for the curriculum was based on the feedback that we collected and also the research that we did. Then we started developing, writing, or drafting the curriculum and the handbook. So we had regular meetings with the planning group to inform the development, the whole process, to make sure the materials that we had or were creating were covering the needs we found in the community. But also we tested the materials after we have finalized the curriculum. We recruited a focus group of community members, transit users, to test the curriculum to ensure that all the information that we needed or public members wanted were covered in the curriculum. And then after the testing step, we made final edits to make sure the curriculum was ready, and we validated it, both the curriculum and the handbook. And because here we were ready for the training. So I will pass it to Kat. She will cover about the training and how we recruited the agency that piloted the training and the next steps.
Thanks, Marcel. I just wanted to show what the curriculum looked like and then our handbook. So the curriculum was used for the actual training. So there were the slides for the training that we did. So the curriculum covers a more general information. So general transit information, how to pay for your trip, how to plan your trip. So, how to onboard, how to ask for the bus to stop or for the bus to stop. And then we had information resources, trying to ensure that for people after they come out of the training that they know where to go to find the information now instead of that they have that knowledge. And so this is an example slide from the curriculum. Recognize when you've reached your bus stop. So, using your app, using apps if you can, using landmarks to know where you are, and things as such, in teaching people how to travel train. And the handbook covers more details and emphasis on how to teach someone to prepare to ride transit. So it's more so, even looking at the time, planning to be there 10 minutes ahead. We also provide exercises on how to tell time, how to count, to be able to pay for your fare, how to count money even, is through our research that we wanted to ensure that we had that kind of resource for the community members that need that kind of support as well. So for the training, we covered the curriculum and referenced the handbook, but we didn't go over it just because of the detail that it covers. So recruiting the piloting organization. So as Marcel mentioned, the next steps was to find an organization that was willing to pilot this training and program. And our goal was to recruit 2 human service and or healthcare organization. And so we worked with the relationships that we had, the planning group members to kind of leverage, the connections that we have there, and to communicate or reach out directly to organizations to see their interests and their capacity and willingness to take on the program. And so we had Maine Health, who agreed to become a partner and pilot the program with us. And so Melindy, I know, is here on the call with us. Melindy was a huge partner in this, and we're really appreciative of Melindy's willingness and for taking on this great program. I'll just drop to also that we are still looking for other organizations, like Zoe mentioned, to pilot this or pilot the program as well. But we were really grateful for Maine Health and thought that was a really good platform, given the number of employees and the role that a lot of Maine Health patient navigators have in supporting community members. So once we partnered with Maine Health, Melindy did a survey, sent out a survey to try to gauge what transportation information that people would like to know, and specifically the people who are in these roles. We also were able to see where those people worked at, so we knew kind of, what kind of information, specifically what agency it might be that they're the information that they're looking for. So once we've surveyed the staff, we worked with Maine Health to customize the curriculum. So based on the needs that we saw in the survey, so cutting down certain slides, and especially because then specifically for Maine Health, 1 hour seemed to be kind of the maximum of, what works in people's schedule. So then we were cutting down what were the most important parts. We wanted to make sure that people are walking away with resources and the information that will really help their role. So then Maine Health promoted the training, recruited the trainees, and then we, GPCOG, Marcel and I conducted the training. So we had the training this year in May. So it was a 1 hour training on Zoom during the Maine Health's lunch and learns. So this is 12 to 1, and we had 75 people registered to attend this training. And out of the 75, we had 71 people attend the training. So we were really glad to see that number. It also showed to us that the need in the community is really there. And so we saw that there's 15 attendees that were from other organizations. So we knew that Melindy asked to open it up to other organizations. We were really excited to. We were glad to see others show up as well. So we conducted a post-training survey to see how effective our strategy and our format of the training, what we covered, all of that was. And so we learned that we knew even through the training that from comments right after the training that we provided, that people really enjoyed and thought they got a lot out of the training, which we were really glad about. So some of the survey questions here. So the knowledge that they gained from the training. So the top 3 that people chose were fare information, transportation materials and resources, and information on paratransit services. And so all people who responded said that they felt like they knew where to go now to access more information if they needed it. And all stated that the training was helpful to their role and would recommend the training. One of the suggestions that we saw was to include more resources for the Biddeford area. So we'll kind of talk about that later, about being more kind of region specific and kind of tailoring the presentation to the group. But given that we were, Maine Health covers the whole state, but this covered at least the Cumberland County and York County area. So we realized that, we couldn't go into as much detail with each transit agency. We'll talk about more about that later. We also added the option to have a follow-up training session. We only had one person who responded that said they would like another follow-up session specifically on, I believe, paratransit services. So we were open to doing a follow-up training session where we could choose, the specific things people want to learn more about, but we didn't have enough interest. So we kind of kept it open though, to ensure that we were providing the support they needed. So after the evaluation of how the training went, we met with Maine Health again to now do the program handoff. So we were ensuring that they felt comfortable now to own the program and to be able to train their staff moving forward, and to ensure that they had access to all the program materials from the curriculum and handbook, and to ensure that now they can adjust and edit it to better suit the needs of the staff. And so whether that's for each different training, to be able to edit it and make it their own program. And so we decided in this meeting as well as steps moving forward that we would have a semi-annual check-in, so every 6 months, to check in and see how we can continue supporting them. If there's anything that's missing of the presentation that they learned through the trainings that they gave, and to provide updated transit information whenever that comes about. We also agreed that, of course, anytime they have questions or need support, that we would be there and provide that support via email or via meeting. So since the handoff in May, we actually met with Melindy and others earlier this week. And so we learned that Maine Health has hosted 30 trainings since May. One training that was a full travel helpers program training. The 1 hour training that we gave. And then the 29 other trainings were about general resources for patients, and they incorporated the transportation information into that training and directed people to the travel helpers program resources. So they have their own platform for employees where they can access all of the slides and the handbook. And so through those trainings, they were able to ensure that people had access to that if they wanted to know more details. So the feedback we got from Melindy and her team was that they felt that they were well prepared and supported so far in continuing to provide this training to their staff. It seems that the trainees really enjoyed that there was a tailored approach in terms of, specifically choosing information that makes sense to their region that they're in, and the role that they hold at Maine Health. And so trainees also suggested to include more community-based transportation resources. We have community-based resources that are paratransit related, but these were more temporary resources that they suggested, such as the MANA resource, transit resource that exists now. So things like that, that could be included. So outcomes. So Melindy shared, and Melindy, maybe after this slide, I'll hand it off to you for any comments, if you have any that I miss. But is that they saw an increase actually in requests for bus passes from Maine Health staff. So this kind of ended up being education and promotion of public transit within their staff as well. And Melindy mentioned that there seems to have been cultivated a new culture within each practice, or the practices where people took the training, where they're seeing public transit or transportation information as something that everybody can, have and know about and be champions for their practices instead of just one or few people, that you go to for transit information. So that was really great to see that the culture change that also this training was able to provide and continue to provide. Melindy also reached out to me after one of their trainings. I guess the group had identified that at one of their practices or locations that there's a bus line that stops there, but it's doesn't go all the way to the entrance. And so that completely limits using that bus service for many of their patients specifically for that location. And so we connected Melindy with BSU Transit, and now they had a conversation, and now they're actually looking and actually will be relocating that bus stop. So that was really great to see that our connection was able to then also cause this. And Melindy, I don't mean to call on you, but if there's anything you'd like to add, please feel free to.
I think that you covered everything that we had talked about yesterday. And I guess I can just say that it's been such a great partnership to have with GP COG. And I don't know how we would have otherwise brought something like Travel Helper to such a large system. And I realize that it's a small portion of people that we serve in the specific area that we delivered the training intended for, but I would hope to see this as a model for other areas as well, tailoring it to the region, to the existing initiatives, efforts, and resources that we have has really been helpful, I think, in how staff responded to the training.
Thanks, Melindy.
Yeah.
I really can't agree more about this unique partnership that's, we work in kind of silos sometimes. So I thought that was it's been really great working with you, Melindy. So takeaways, I want to be mindful of time. We definitely realized through the process, that there's continues to be and still is the significant need for a travel training resource like the Travel Helpers program. We realized how transportation information is really vast. So even, give it just, okay, I live in Portland. I only want to go to places in Portland, for example, and there's just so many options. So we realized how important it is to then tailor the training to each audience. So knowing what they want to learn about is really helpful beforehand, especially to their region and their role. And Melindy said something that I thought that was really great, is that by doing this, by tailoring and identifying their need, that you're not making the extra work for them, right? That makes these kind of trainings really difficult. So tailoring whenever you can. And then I'm actually going to pass it off to Marcel, but before I do, for the rest of it, I also wanted to mention that we realize how important also it is for organizations to pilot this program and own it as well, because they know the need of their staff and what they do better than we do, right? Coming in, and there's a need for that as well. But we thought it's been really great to see Melindy and the Maine Health team take it on and to provide the training in a way that really works for the staff. And I'd like to also add that through this process, GP COG, we realized that there also needs to be a general travel training that's available to any community member or staff member of any organization that would like to have this. And so we actually just we're close to I think getting this grant that will allow us to actually we're thinking like doing one general travel training for anybody who wants to take it once or twice a year to start. But yeah, and so I'll pass it off to you, Marcel, and then we'll go into questions.
Thank you, Kat. before I talk about the main takeaways, I would like to talk about the goal that we had of recruiting 2 agencies to pilot the program. We ended up with Maine Health because other organization could not buy in, or because of the pandemic, it was during a difficult time. So we were lucky to have Maine Health with us as one organization that show interest in the program. So main takeaways here, I can the importance of building relationship enabled us to do everything. And we are very grateful for all partners who were involved in this, including Maine Health, because every single relationship or connection matters. No one should be ignored or underestimated, because we were connected to Maine Health through the planning group members who helped facilitate the connection. So we really value bridge building as an effective way to create durable solutions. Thank you.
Thanks, Marcel. Yeah, we would love to open it up to questions, and I will stop sharing my screen.
I have a question. So here, and I'm looking at the time, so I'll try and keep it brief because I honestly could talk to you guys for hours about what we're doing over here. So in New Hampshire, I'm not sure if some of you are aware, but we have 8 regional mobility managers, and then I'm the statewide mobility manager. And one of the things that I wanted to implement almost like right away, and then I had to take a couple steps back, was travel training. So I started taking the Easter Seals travel training program. It could take up to 2 years to take it. There's a lot of great webinars, and I had no idea what they were calling travel training. I mean, it's mind-blowing. I started reading some of the information and everything, and I was like, good grief, now I know why it takes so long. And the webinars are amazing. So if any of you have time, it does cost money, but it's absolutely mind-blowing. And so some of the things that we're doing over here is the regional mobility managers actually went through and made brochures of all the transportation options in their region. And they're getting to communities, they're doing outreach events, those type of things, because one of the things we found was #1 thing was people didn't even realize what their transportation options were. And it sounds like you guys hit that nail on the head in your forums and stuff like that. And then they're also working, they're doing a little bit of travel training. They're, if somebody has an opportunity, they're bringing them in, they're sitting down with them. There's actually forms that we're going to be using, and they're going to do travel training from where do they need to go, what are their options, and then walking them through actually using the bus, using the volunteer driver program, talking with the taxi companies, whatever the best option is for them. And then they're also going to ride the bus with them if that's what they decide that they want to do. And this kind of came about kind of the same thing. We've been listening to what the communities have to say. And a lot of people are just afraid to use public transportation, or they don't even know that public transportation is an option. They think a lot of the buses that are running around are for older folks. So we're really working on that through this winter of trying to get that stigma out of their head that public transportation is for everyone. So that's just, I am so glad you guys are doing this up there and that it's successful. I definitely took a bunch of notes, and I'll put my information in the chat if anybody wants to reach out to me. And but thank you so much for this invitation. This was awesome.
Thanks, Terry. I was going to ask for your email, and I'll throw mine in too for others as well. But that sounds like you're doing really, really great work in New Hampshire. And I think being able to do outreach events we would love to get to that point. But we're excited to do what we're able to at this point. there any other questions?
This is Sarah, Kat, and Marcel. I just wondered, I've been working on a transportation plan for Riverton Park, Portland Housing Authority. They're gonna do a big renovation there eventually, and some more suburban context, lots of tricky, but with some transit access. But I'm just wondering, I saw you had some housing organizations on your initial planning group, and I wondered if you feel like eventually you might get some buy-in for a pilot among like residential service coordinators or that kind of thing. So just curious.
Sarah, that's a really great point, and I'm gonna allow, Marcel, if you can answer that, that'll be great.
Can you repeat the question, Sarah?
Sure. It's I'm wondering, I know you had as part of your planning cohort were some housing organizations, affordable housing organizations, and I just wondered if you could imagine, and I'm sure between pandemic and capacity, whether everyone's right out straight, but whether you could imagine there being like a buy-in, maybe of collectively of various affordable housing organizations to do training with their residential service coordinators, the folks who are on site working with residents.
We had the Avesta Housing on the planning group. They were really engaged because they saw value in this program, because they thought they know that they have many people, other adult people with disabilities who live in their houses. So they saw a big value in this program, which makes me think like if they can start something, be part of this program, that's why they see value. The program will help their clients, their tenants, and so on. So yeah.
And I'll add that I think we had it was tough finding other organizations that would be willing to pilot because they see it as like a big task. And I think that's where we were seeing, the need for us to continue just being able to provide the training without, getting the buy-in of a whole organization, as much as that would be really effective. So we're also hoping to kind of be able to expand our capacity to be able to do that eventually. But really, that would be really great, Sarah.
I'll put it in the plan. They should reach out.
This is why we do these things.
I know, it's so great to learn what you're up to.
Thanks, Sarah.
I think we probably have time for one more question or comment before we wrap it up.
So this is Wendy. Here in Central Maine, I see this as a great opportunity for, certainly the teams that I work with, social workers, community health workers, care managers, et cetera. And yet, our resources are more limited. We have, much more limited public transportation, but there is some. Certainly we have a great partner in KVCAP and their transportation services. What would sort of the next step be in your mind for, how do we sort of replicate this, in the Central Maine area? How much of it is specific to, the transportation resources you have? I mean, there are, just some of your examples, providing exercise on how to tell time or recognize landmarks. Obviously, all of that is, sort of more general information, but, what would you see as sort of a next step to do something similar in this area?
Yeah. And I think Marcel and actually Zoe will probably definitely have to add. I would think the first step would be to reach out to, your local transit agency or the MPO, like GPCOG is the region's metropolitan planning organization. So reaching out to them, I think, would be probably the best. I don't know, Zoe, what would you suggest?
Yeah, you read my mind, which happens with me and Kat, but I think this is part of what Moving Maine is championing, is that we don't have an entity like what GPCOG has been doing in numerous parts of the state, and we think we need it. We have been championing sort of making the case that having mobility management programs, which is essentially what we built over, it took us a while, but over about 5 years at GPCOG of work to build up outside resources. I think we really demonstrated that when, that there's a need for it, and we'd like to see other parts of Maine get to have the same thing. And the same thing in the sense of the capacity and like the people there to make the solutions, knowing that the solutions themselves will be different in different regions. But to say, like, at minimum, every region has a handbook, like the materials that go along with travel helpers, that it's specific to that region. So that's something we're advocating for. We're hoping it shows up in the Maine DOT state, well, the family plans that they're working on right now. And we're also having conversations with, with DHHS and others. So I would love to see more folks add their voice to that. I was going to put a plug into the just in the chat that if you wanted to join it's going to be a very long link, but it'll take you to a sign up form to be part of conversations about policy. I would say, Wendy, I would love to have a conversation with you about some ways we might, so that's sort of a longer term vision, having mobility management programs across the state. But I think there are actually funding opportunities out there right now that could be leveraged to do something in the shorter term. And I'd be happy to talk about it.
Great, thank you.
Yeah,
Zoe, I have one quick question. Do your MPOs or RPCs, do they have like a transportation planner in each one? Sorry, my mouthy cat just woke up too. So do you have like, because I know some of our RPCs have transportation planners. Is that the same way in Maine?
Yeah, well, in Maine, we have 4 metropolitan planning organizations that have a lot more resources, and then the rest of the state is covered either by Maine DOT or a regional planning organization. So there are transportation planners in all regions, but the capacity looks really different. And I know we just hit 1 o'clock, and so I know people need to leave. I guess I'll just say, if folks have time, if folks want to stay on and chat for a couple more minutes, I'm happy to do that. But otherwise, we will see you in November, and we have a great conversation about equity in electrification of vehicles and fleets. And we're going to have some really interesting folks talk with us, including talking about, can we get subsidies for e-bikes, and other equity issues on that. So thanks folks for that.